Hello, everyone, and welcome to another Wednesday Connecting the Dots with Dr. Ashaye, a great place to be if you desire to take charge of your health so that you can live fully while enjoying doing what you love. And today I'm here with a special guest, Dr. Andrea Wadley, who is the owner of and head pediatrician of 127 Pediatrics, a home visit only direct primary care pediatric and lactation practice in Dallas Fort Worth area in Texas. She provides convenient and quality evidence-based pediatric medical care in the comfort of your own home. She also offers breastfeeding medicine consults to mothers in the community and online breastfeeding education and support. And today we're going to talk about breastfeeding and direct primary care. Welcome, Dr. Wadley.
Thank you. Thank you for having me.
Yeah, I'm really excited about this. But before we get into it, this is Connecting the Dots with Dr. Ashaye. I'm your host, Lola Ashaye. I'm a family medicine and lifestyle medicine doctor and owner of In Touch Primary Care, a membership-based clinic in Sugar Land, Texas. And I'm so excited you're here. If you're seeking a much more convenient and proactive approach to your healthcare, come join us. You can enroll at www.intouchprimarycare.com. And remember, you can listen to this episode and all our episodes on the In Touch Primary Care YouTube channel. Leave comments, subscribe, and please share with someone that might need it. You never know, it could make a huge difference for them. All right, so let's get into it, Dr. Wadley. What would you like to share about yourself and personally or professionally?
Yeah, so I started a direct primary care pediatrics practice. About 5 years ago, so it'll be 5 years in July, at a time that direct primary care was starting to kind of take off, but really unheard of in pediatric care. So I guess I am a pioneer of DPC pediatrics. But previous to that, I worked in the hospital as a newborn physician. I did rounding on newborns as a hospitalist for the first 8 years of my career, and then transitioned into a direct primary care practice. So I chose to do DPC because I just wanted to provide something very different for people. So I'm sure in Sugar Land it's the same, but here in Dallas Fort Worth, all of the, clinics and especially pediatric clinics are hospital based and hospital owned, and so there just wasn't very many options outside of that system for people to choose from. So I chose to do direct primary care peds for that reason. And then as a former newborn hospitalist, I became more educated in breastfeeding medicine. I took the IBCLC exam and then educated myself more in the medicine, the background of breastfeeding. So I offer those consults to families in the Dallas Fort Worth area that are inside of my practice and outside of my practice as well. And then on top of that, I chose to do home visits. So, home visits are really the best way to take care of new moms and babies. You have children. You remember what it was like when you first gave birth, and then suddenly you had to go take this small person to the doctor when you were too tired to even probably get dressed. And so I thought that that would be a better way to provide care for new families and breastfeeding moms. So that's a little bit about my practice and a little bit about me. I'm also a mom too. So I have an almost 10-year-old daughter, and then I'm a step mom to a 22-year-old. And my husband is also owns his own business. So we're a family of entrepreneurs.
Wow, so that's great. No, I'm a mom too, and I had twins as my first. I have three kids, but the first were twins, so I can certainly appreciate someone coming to the house for visits. So those first few visits where you're like, having to bundle them up. And we lived in Chicago then, and I can imagine it would have been so much easier if I had my doctor just come to my home. So yeah. All right. So someone listening may not know what DPC is or direct primary care. Can you explain it just a little bit more?
Yeah, so direct primary care is, I call it a movement. So it's been a movement among physicians probably for the last maybe 10 to 15 years. It started with a group of family physicians who just wanted to provide a different way. So kind of go back to our traditional system where, you pay your doctor directly, you get the care that you need. So direct primary care really is a membership based type way of doing medical care. So you pay the doctor a small fee. It's monthly, and that provides you with the primary care that you need. So like a family physician who takes care of all ages, that can provide for care for the whole family. Me as a pediatrician, I see kids from 0 to 18. So in my practice, the fee would cover the children that you sign up under the membership for me. So it's really a very great way to do medicine. So it brings us back to a time where we can have smaller patient panels. My patients can text me. I know all of their kids really well because I don't have the thousands of patients on my panel. I just have a very small patient panel. So that is kind of direct primary care in a nutshell.
Yeah, no, that's great. And I think the part that you talked about, for you, the added part of going to their home is huge because you can see them in their natural environment. You can see multiple kids at once, which is another thing. Like I have an appointment with, when I've had appointments with pediatricians, I can only take two of my children at once. I can't do all three appointments. Those little things that make it inconvenient. By going to the home, it really makes a big difference. So that is great. All right. So as a mother of three young children, I understand, that it's really difficult to take several children to the doctor at once. So I talked about that already a little bit for me because I've experienced it. And how else does your practice address that?
So I attract families that have multiple children for that reason. So some of my bigger families have 4 or 5 kids, and so instead of dragging everyone to the office, no matter if they have an appointment or not, I come to you. So a lot of times, I can come to you after the baby's done with their nap, and I can see the siblings. In medicine, often if one person gets a cold, everybody else in the house gets it too. So it's easy to kind of just line up the kids and see everybody at once and know basically that it's going to be the same cold and kind of give mom instructions with that. And then, if you have a small toddler and then you have a baby that needs to be seen, I come to you. The toddler can play in their wherever they're playing and be involved with the visit while I see the baby. And mom doesn't have to pack everyone up and try and entertain the 2-year-old, while the baby's being seen in an office. So those are some definite benefits to home visits. As well as what you said, it's really nice to be able to see kids in their home environment. They're much more comfortable. I do shots and all of those things, and usually they do a lot better in that sort of place and environment. And then it's great for me because I can see, you can tell me that your baby's sleeping safely, but if I can see that you're putting your baby in some other, container or device that's not safe, I can point that out to you. So there's no hiding with home visits, I guess.
Yeah, so many benefits, so many benefits. I can see how it's such a valuable service. So thank you. So we're going to switch gears a little bit. So many moms have difficulty breastfeeding, and I can testify to that. What are 3 practical tips you can share with mothers that are having challenges with breastfeeding?
So first, it's not really a tip, but just you're not alone. So I'm working on a breastfeeding online class, and every time I tell someone that, they say, "Oh gosh, I remember when," and everyone has a breastfeeding story. So you're not alone if you're having trouble, or if you're having trouble or anticipating the breastfeeding's hard. So 3 practical tips would be really to educate yourself. So there's a lot of things that occur with breastfeeding that are very time sensitive. So if you're not, knowledgeable in kind of an outline of the process or like a roadmap of what is going to happen to your body, that by the time you kind of figure things out, or if you realize you're having problems, it's a little harder to walk back and get to a better place than it is to kind of start off on a good foot. So education. So prior to delivering, make sure you take an online class, you take a class at the hospital, wherever you're connected to, but just make sure you're educating yourself about the process of breastfeeding. The second thing would be to, and I wrote a little note so I wouldn't forget, to set up your team. So I'm big on it takes a village. So, back in the day when we all lived in multi-generational families, homes, people, the mom, the mother-in-law, everyone would be there to help you care for your baby in those early days. And, breastfeeding rates were higher back in the day when we had all this help, right? And so your job as a new mom really is to heal and to breastfeed, because it is a full-time job really in the beginning. So thinking through who can help you accomplish those goals before you get to that place. So, can you have your mom come stay for a couple of weeks and her assignment is to do all the cooking? Can you have your husband change diapers in the middle of the night and cuddle the baby and put them back to sleep so that you can breastfeed and then go back to sleep? Thinking through what that looks like in your life, and then asking other mothers, who have been there, what would be helpful. So making sure people have assignments and aren't just coming to, hold the baby and be entertained, but are making sure that they're helping you, right, in this process. And then another thing would be to ask for help early. So if you start to get into a place where you are having lots of pain with breastfeeding, or it's just not working, or you don't think the baby's eating well, make that call early, set a budget, have some money set aside for lactation visits. Insurance plans will pay for lactation as well. So just make sure you're asking for help early, and, asking people in your community who it is that is good for helping you with these things ahead of time. So those would be my top 3 tips.
Yeah, those are great tips. Yeah, absolutely. I hear you say prevention is better than cure. So try
Yes.
to learn early what you need to do, have your team. And I love how you said have assignments. I used to write down what I wanted done so that nobody was confused, because with the twins, I had to be very organized. So this is awesome. All right, great. So tell me more about the practice, the solo practice 127 Pediatrics. How did you come up with that name?
So again, I wanted to be different, and my faith is very important to me. So I scanned through the Bible to try and find, a name that would resonate with me, as well as, my patients and the people that I wanted to attract for the practice. So 127 is actually from Psalm 127. So children are a heritage from the Lord. Whatever, the Lord builds is what's going to be. And so I took it from that Psalm. And then, if the Lord doesn't build the house doesn't stand, is, part of that verse. And since I was doing home visits and my logo's a home, it felt like that was the right decision for the name of the practice. So
That's beautiful. I love that. That is I love it. Okay, that puts some context to it too. So now every time I see that, I'm going to remember that. That's beautiful. Great. So can you tell me a story about how your practice made it easier to manage or prevent a serious health condition?
Yeah, so I guess stitches would probably be the biggest thing. So I have one family that's, has several kids, and they are very adventurous. And so I've been to their house and I've done stitches multiple times on several of the children, but one of the children several times. So that really saves mom a lot of headache. And that child is, a little bit more scared of things, and so she trusts me. And so the ability to do stitches really at someone's house is pretty incredible. So that helps. And then, there's certain things that I can manage that, in a busier, bigger practice, I probably would send off either to a specialist or to the ER. So, recently the end of December, I had a child that had pneumonia, and I was able to manage him mostly because, mom has access to me and can text me. So she was able to monitor his oxygen number, and we were doing antibiotics, and I was able to check on him a couple of times. So stuff like that keeps a lot of the patients out of the ERs and away from the urgent cares and that kind of thing. So those are two examples. I'm sure there's a million more in the last few years. I just can't think of them now, but.
Yeah, those are great examples. I mean, I think sometimes when we talk about membership and people having to pay a fee out of pocket for their care, sometimes people are wondering how they benefit from that. But that example makes, and I see that in my practice as well, where people end up saving a lot of money because they avoid going to the emergency room, going to the urgent care. They save a lot of time. Time is money as well. With you, especially going to their home, they can keep doing whatever they're doing until you get there. So it's a huge benefit to families, what you're able to provide. Great. So do you have any parting words or advice or quotes or anything that you want to share with our listeners before we end today?
Gosh, I don't know. So you and I are both in the same, business education for physicians this year. And I think from that, I've learned to, live life and incorporate it into the things you're doing. So, spending time with your children, you'll never regret spending some moments with your children, versus working versus doing whatever else. So, and then spending time with family and vacations and just making sure that you're taking care of yourself and others, instead of just working all the time. So, yeah.
That's good advice, especially if any physicians are listening.
Yes, exactly.
Yeah. All right. So how can people find you?
So I am on most of the social media channels. So Facebook is 127 Pediatrics. My Instagram is 127 Pediatrics, all spelled out. And I am doing Instagram lives on Fridays. So with people who are within the breastfeeding community realm. So we're going to have a sleep consultant on later this month. So check that out. And then LinkedIn, I'm on there. And then I have a YouTube station, 127 Pediatrics YouTube station. So.
Okay, great. And we'll have all this posted in the comments so people can find you easily. But thank you so much. This has been helpful. So thank you, listeners, for listening. Remember to subscribe and share with someone who may need it. And if you're in the Houston area and you like to experience the peace of mind that comes with being able to reach your doctor directly when you need it, then come join our membership practice in Touch Primary Care. You can enroll on our website, www.intouchprimarycare.com. So thank you for being here, and see you next week, 2:15 Wednesday next week. Take care. Bye-bye.